Hi, this is Meredith with the Cedar Rapids Public Library. Did you know that May is Mental Health Awareness Month? Mental health is as important as physical health, but it's often not discussed or addressed, and it's even dismissed for many reasons. Right now, taking care of our mental health is even more important. The pandemic has affected us all, and for some of us, it's affected our mental health, which could continue after the pandemic. It's essential to prioritize our mental health and stay connected with friends, family, and peers. No one should feel alone in their mental health journey or without the resources and support they need. The following are some resources to help support our community in talking and sharing about our mental health, and some books that offer insights to fictional and real characters that will build empathy, understanding, and coping mechanisms. And they'll let us know that we are not alone. I relied heavily on the National Alliance of Mental Illness, NAMI, and Iowa's Make It Okay Healthiest State Initiative for information for this program. I think that it's important to realize that although no one is immune from mental illness, getting resources for treatment and support can be more difficult for people that are disenfranchised or marginalized, or that are part of vulnerable populations or communities. So for instance, lesbian, gay, and bisexual youth are 4 times more likely to attempt suicide than straight youth, and transgender adults are 12 times more likely to attempt suicide than the general population. The average delay between the onset of mental illness symptoms and treatment is 11 years, so being young makes you vulnerable. 55% of U.S. counties don't have a single practicing psychiatrist, so rural individuals are vulnerable. 3.8% of U.S. adults experienced mental illness and a substance abuse disorder in 2019, and although 3.8 doesn't sound like a lot in a percent, 9.5 million people does sound like a lot. Mental illness and substance use disorders are involved in 1 out of every 8 emergency department visits by a U.S. adult. 20.5% of people experiencing homelessness in the U.S. have a serious mental health condition. 33% of adults incarcerated in the state and federal prison system have a diagnosed mental illness. 70.4% of youth and juvenile justice system have a diagnosed mental illness. And 41% of Veterans Health Administration patients have a documented mental illness or a substance use disorder. You can find these statistics and their references on NAMI's website. For books, let's begin with some for younger readers. Hector's Favorite Place helps children process and normalize anxiety. For older readers, 8 to 12 years old, Warp Speed is a fast-paced chapter book that deals with responding to bullying. My Family Divided is for readers older than 12 and is the story of Diane Guerrero's childhood when her family was deported back to Colombia and her depression that subsequently followed. For young adult readers, Darius the Great is Not Okay is a story that doesn't focus on the crisis of suicide, but on the person that experiences the crisis, making the story about processing mental illness and living with it. How It Feels to Float is a story of intergenerational mental illness and how one young woman goes through her teen years without her father. And Highly Illogical Behavior is the story of one young woman who makes it her goal before college to help her agoraphobic friend leave the house. For adults, Don't Call Me Crazy is a collection of actors, athletes, comedians, and other public figures sharing their experiences with mental illness. Candid and funny, these stories reveal a reality that the general public rarely sees. Maybe You Should See Someone is the story of how one psychotherapist enlists the help of a therapist after a bad breakup. She shares her experience on both sides of the couch, so to speak, with humor and grace, and certainly makes us feel less alone. and First We Make the Beast Beautiful is an engaging and witty book written from experience about dealing with anxiety. Entertaining and informative, readers will find much to relate to, understand, and to employ as they manage their own anxiety. If you are interested in more stories or would prefer to listen to these voices instead of read them, please visit the NAMI website to learn more about the Strength Over Silence series, which is a collection of stories from people that experience mental illness from minority groups. Also, Iowa's Healthiest State Initiative has a Make It Okay podcast where individuals share their stories and experiences. For more resources, you can visit the local NAMI chapter, NAMI Lynn County. It's a nonprofit, all-volunteer organization which offers an array of free services, including a resource and referral phone line, support group for consumers, family members, and friends, educational classes and programs, educational forums, community events and activities, a speaker bureau, and advocacy and fundraising activities. NAMI members are persons living with mental illness or with mental health issues, which are also referred to as mental health consumers, but also spouses, parents, children, relatives, and friends of persons living with mental illness. NAMI members also include mental health care professionals. You can visit their website at namilynncounty.org for more information, or follow them on any number of social media outlets, but most active is their Facebook presence. You can also visit iowahealthieststate.com for more information about the Make It Okay campaign and other initiatives to help Iowans attain their best health. Additionally, especially during the month of May, many local chapters of NAMI are hosting free events discussing mental health, like this upcoming presentation, The Troubled History of Schizophrenia, How Race Shaped an Illness, which is facilitated by the New York Metro NAMI chapter. So keep your eyes peeled for opportunities to be informed and engaged. If you have any questions about the Read Woke Challenge, about something that you saw in this presentation, or anything else related to the library, please let us know by calling 319-261-READ or visit crlibrary.org. For all of us here at the Cedar Rapids Public Library, thanks for watching.